Imagine a lottery, but like it's the absolute worst kind. You really do not want the winning ticket.
Right, when you desperately want to lose.
Yeah, exactly. But the catch is the odds of your name being pulled aren't random at all. They actually shoot way up depending on your zip code.
Which is pretty terrifying.
It really is. So welcome to today's deep dive. We are exploring a really compelling article from MCI and Beyond titled What Dementia Care Looks Like in Poor Communities.
It's a tough read, but super important.
Definitely. Our mission today is to uncover the harsh realities of dementia care inequality, explore these systemic gaps, and figure out why cognitive health equity matters directly to you. Okay, let's unpack this, because the core premise of this article is incredibly cruel, which is that dementia just does not affect everyone equally.
It really doesn't. I mean, we tend to think of cognitive decline as this, great equalizer, like it's just something purely biological that happens to anyone as we age.
Right, like it doesn't discriminate.
Exactly. But this source completely shatters that illusion. It shows us that the experience of living with dementia, or even caring for someone with it, is heavily, heavily shaped by economic reality.
Yeah, and it starts long before an actual diagnosis, right?
Yeah.
The article points out that resource deprivation actually increases your risk of developing dementia in the first place.
Yes, it does.
It links back to a lack of educational and professional attainment over a whole lifetime. But, I mean, why does that actually matter on a biological level?
Well, what's fascinating here is a concept called cognitive reserve. You could think of it kind of like a city's power grid.
Okay, power grid.
Yeah, so if a well-resourced city has multiple backup generators built up over years, which in the brain's case happens through complex education, engaging jobs, and low stress,
It can survive a storm.
right, it can survive a massive storm like dementia plaques without losing power. The symptoms are delayed or they're just masked completely.
Oh,
But a brain stressed by poverty often just hasn't been given the resources to build that backup grid. So the very first storm causes a total blackout.
that is so wild. So poverty isn't just resulting in worse care after the fact, it actively creates the vulnerability. It's like being forced into a rigged game.
Yeah, that's a really good way to put it.
You are made to play with a much higher risk of losing, but you're given absolutely zero defensive tools to fight back. No specialized memory care, no facilities.
Nothing at all.
Plus, the article notes that counties that actually have dementia care options have significantly higher median incomes.
Exactly. And because that formal care is completely inaccessible for low-income communities, we have to look at who is forced to step into that void.
Family members.
Right. The article highlights that families, and predominantly women, become the only safety net. They're out there working multiple jobs and trying to manage incredibly complex behavioral symptoms with zero professional training.
It's just an impossible burden. And, it gets even more complicated when we look at the types of dementia cases they are dealing with globally. Like the source notes that in Latin American countries, 54% of dementia cases are tied to modifiable risk factors.
Yeah, that number is staggering.
It really is, meaning things like untreated high blood pressure, diabetes, or smoking, which physically damage the blood vessels in the brain over time. But wait, hang on.
Yeah.
If 54% of these cases are from modifiable risks, isn't calling this a dementia care crisis sort of letting governments off the hook? Like, this sounds like a massive failure of basic preventative public health, not just a shortage of memory clinics.
I see. Well, if we connect this to the bigger picture, you're absolutely right to call that out. A huge portion of the global dementia burden, especially in poorer regions, is theoretically preventable.
Right.
Caregivers are being completely crushed by cases that honestly just didn't have to happen in the first place.
Right.
But preventing them requires political will and resources that simply aren't being deployed where they are needed most.
So we have this massive systemic neglect. But thankfully, the source doesn't just leave us in the dark. It actually lays out a blueprint for change.
Yeah, they strongly advocate for community-based models.
Right. Things like paramedicine partnerships, which basically means utilizing local EMTs or paramedics to do regular preventative home check-ins.
That's a great initiative.
It is. And also training programs for family caregivers. And crucially, tackling the social determinants of health.
Right, which simply means looking at the actual environment where people live. Things like the quality of your housing, your access to fresh food, or even whether you live in a highly polluted area.
That makes total sense.
Instead of only funding research in wealthy zip codes, equity needs to be centered right there in public policy.
So what does this all mean for you listening right now? Maybe you don't live in a low-income community, or maybe you don't even know anyone with dementia. But the article includes this brilliant quote from Rosalind Carter that puts it all into
I
perspective.
love that quote.
It's so good. She said there are only four kinds of people in this world: those who have been caregivers, those who currently are caregivers, those who will be caregivers, and those who will need
Okay.
caregivers.
And an inescapable human reality. At some
Yeah.
point, this touches all of us,
Mm,
which really makes the fight for cognitive health equity a universal fight.
absolutely. But before we wrap up, there is one haunting detail mentioned at the very end of the source that we need to leave you with. It mentions the forgotten ones.
Yeah, that part was heavy.
People who have dementia while living on the streets or while they're in jail. Just think about that rigged lottery we talked about at the start. How does a society even begin to track, diagnose, or protect someone who is slowly losing their mind while just trying to survive homelessness or incarceration?
That is a really tough question.
It is a heavy question and definitely something to ponder until our next deep dive.